Hi, it's Jess. Alright, so today we're going to extubate. So first you need to receive and verify the order from the physician. Then we're going to tell the nurse so that they're not shocked that we're extubating. And then we're going to get our equipment, which is the suction catheter, syringe, the scissors, the yanker, and gloves, and oxygen delivery device. And today we're going to use the nasal cannula and then also a stethoscope. And so now we are going to wash our hands and then put on our gloves. Oh, we also need a syringe. I'm not sure if I said that. Okay, so then I'm going to walk into the room and then I'm going to say, Mr. Jones, I am Jess, an RT student. You're going to take your tube out today so that you can breathe on your own. So I'm going to sit him up in a semi-fowlish position, and we're going to check his vitals, and then if they're all good, and then we're going to assemble the nasal cannula so it's ready right after I am done extubating. And then I'm going to hyperoxygenate on the machine. And then once his SpO2 is up to 99 or 100, then we can start the process. I'm going to suction the ET tube if necessary, but today he is good and does not need to be suctioned right away. And then I'm going to use the yanker and just get out anything right in his mouth. And then I'm going to take the red rubber and put it all the way down and suction all that stuff out so that when I deflate the cuff, everything doesn't drop into his lungs. And then I'm going to make sure that the yanker is ready for right after I'm done extubating, because they'll have some stuff that comes out. And then I'm going to deflate the cuff and make sure that there is air movement. And then hold this over here, and I hear and feel air, so Mr. Jones is all good. So then I'm going to inflate the cuff, and then I'm going to take the tape off the ET tube. And then with my nurse here, I will make sure that it is being held in place so it doesn't go anywhere. Okay, now I'm going to say, Mr. Jones, can you take a big deep breath for me? And then after he's done with that, I'm going to deflate the cuff. And then I'm going to have, Mr. Jones, can you cough for me? And then I'm going to remove the tube in the following curvature, the natural curvature. And then right away my nurse is going to put on the nasal cannula that is already hooked up to oxygen. So he's getting oxygen right away. And then I'm going to encourage Mr. Jones to cough so that he can just get anything out that's there. And I'm going to yanker, get anything that's left in his mouth so he feels okay. And then I'm going to assess Mr. Jones and make sure he's doing okay, that he hasn't aspirated, or that make sure his vitals are okay. And then I'm going to listen to him. And it seems that everything is okay. I'm going to make sure there's no laryngeal spasms or glottic or subglottic edema. And I'm going to check for stridor along his neck or trachea. And then after that, I'm going to make sure his general appearance is okay and his respiratory pattern is okay. And then I'm going to inform the RN the time of extubation and the patient's tolerance of the procedure, and then document that. And then I'm going to evaluate indication for bronchial hygiene or lung expansion therapy, and just let the physician know what I think, or let my instructor know what I think for that. And then we will be all set. And that is how you extubate.